I'll be behind you.
Okay, I'm Nurse Deanna, and this is my patient, Chris. So he had an appointment at the free clinic for irritable bowel syndrome, and the doctor prescribed him the Prozac. So I'm just going to talk to you about this brochure that gives you a bunch of information on how to manage your symptoms and different medications you can get at your local drugstore. And I'm also going to talk to you about the medication that the doctor's prescribed you. Do you have any questions so far since he's talked to you?
So I'm being prescribed this depression medicine. I want to know why I'm getting that instead of something for pain, since I have this syndrome.
So you're being prescribed fluoxetine, or Prozac is another name for it. So it is an antidepressant, but in your case, it is actually being used for the pain. So it's given in a lower dose to you than for a person that it's being used for with depression. But it has been shown to improve the pain and your bowel symptoms. So it relieves the symptoms and the problems you have with your IBS. And it does this by increasing neurotransmitters that are in your spine that usually reduce pain signals. So this increases neurotransmitter, it reduces the pain signal, which then reduces your perception of pain because it's sending a less strong pain signal to your brain. So it's more about the perception of the pain than in turn it's you're not in as much pain. In addition, it also increases the muscle movement. So like when you're having constipation, it increases that muscle movement, relieving that constipation. And because it is in the category antidepressant, it can also help with calming you, but it's not treating that depression. It's treating your stress. And stress is a major factor with irritable bowel syndrome. It causes you to have like a flare-up and causes you to have stronger symptoms.
Okay.
So the medication is actually very cost efficient. Without insurance, it's about $200, but with insurance, it's only going to cost you about $5.
Okay.
So also, fiber is going to be really important in your diet because it's going to help to relieve the symptoms with constipation because it helps more water to remain in your stool, therefore like making it a looser stool. And it also adds bulk to the fecal matter, and it prevents like that feeling of constipation that you get. So you can add certain foods to your diet, such as broccoli, beans, carrots, pears, whole grains. Apples are good as well. And also having diarrhea, you can benefit from taking in fiber because it helps to improve the consistency. So it works in both sides of irritable bowel syndrome. But it should be started at a low dose. So you want to start it in your foods, and if that doesn't help, then you can take a supplement. Other things that you can look into at your local drugstore are going to be anti-diarrheal medications for when you have those bouts of diarrhea. So that's going to be Imodium, which slows the movement of your stools, so it helps to kind of harden everything. And it should only be taken as needed because you don't want to take too much because then you end up constipated. And then for constipation, you want to increase your fiber as well. And then you could take laxatives, which are over the counter. So there's milk of magnesia and there's Miralax. So those are going to help to loosen you up and help you like have a bowel movement. And probiotics are going to be really important because when you're having these bouts of diarrhea, you're losing so much nutrients through your stool and also becoming dehydrated. And it's tearing up the normal flora in your intestines. So taking the probiotics helps to replace that good bacteria that you want in your body. Also, just to manage it overall, like I said about stress, some people go to therapy. It does help to reduce the stress because that is such a big factor in making the symptoms so strong. And relaxation techniques. There's also mindfulness training, which isn't as common, but basically, I guess it's just techniques to make you have kind of a more calm mind and body. So you want to avoid high gas foods and gluten, and then there's certain types of carbs as well, because those foods are going to increase the chance of your IBS coming back. And you do not want to drink, you do not want to smoke, and you do not want to drink fluid with your meals because it can irritate your stomach and make this a problem once again. So you want to drink 6 to 8 glasses of water daily, which is a normal intake, which will help to manage everything going on, and also have a regular eating and exercise schedule, because if you're eating regularly, you're less likely to have abnormalities and your body gets used to the schedule. And same with exercising. Exercising is very good for that motility and keeping up the excuse me, you probably won't understand that word. It's the motility in your bowels, making sure those muscles are nice and strong, and lessening your chance of constipation. And also just exercise is always good for the body. So do you have any other questions or concerns besides the medication? Do you understand why you're on it now and you're not being treated for depression?
Yeah.
Because you don't have depression. It's just that certain medications like this one can be used for other things than for the main reason. Like, it is definitely, it's considered an antidepressant, but it can be used for other things besides depression because it's a calming agent, basically.
Oh. I think I'm good. I think you explained it really well. So I think I have a really good understanding of what I'm doing now, like with this medicine. I think it's gonna help me, and I need to get on the schedule to exercise and eat regularly, and then I think I'll be good to go. If I have any other questions, I'll be sure to let you know.
Okay, so I'm gonna give you this information that we carry here at the free clinic.
Okay.
And if you have any questions, you can call back. I could speak with you, or the doctor could, and they'll have that prescription ready for you as well.
Thank you so much, Nurse Deanna.